Tapi most actually I would like this completed lecture lah basically just telling how to dilute certain drugs that yang orang sebenarnya yang biasa kalau dekat dalam OT dan patient very ill, very kata requiring ICU admission, and sometimes certain drugs need to be started dekat dalam OT itself. So it's just briefly how to dilute and what the concentration before you need to send them further to ICU. So, I think probably a few more coming, or the orange group. Never mind, I think we'll start first. So, yeah, the first one is going to be inotropes and vasopressor dilution, so followed by sedation, and after that, a few miscellaneous drugs. This is just a case presentation. I'm 43 years old, commonly presented in the OT. Now, what we take septic, and then post-induction, we drop. So, we need to start on something. So usually, what do we give? Inotrope? Anything? Dopamine. Noradrenaline? Someone, what other inotropes do we have? Norad, yes? Dopamine? Dovitamin? Yes? Okay. So our choice for this one would be dopamine. Huh? So for this, 1 ml of dopamine is about 200 milligrams. So the concentration is 40 milligrams per ml. So normally dilution ni kita dilute dengan apa? Dextrose 5 or actually any dextrose containing solution. Maksudnya kalau tak ada dextrose 5 kat dalam ICU dan dalam OT, kan dextrose saline pun boleh pakai lah. Tak ada pakai solution, mesti nak dextrose 5, any dextrose containing solution. So we kata how to dilute. Basically kita punya dose kita nak 3 mg per kg. So we roughly guide patient berapa kilo. So patient katakan berapa? 70 kilo. So 3 mg per kg, 3 times 70 is 210 mg per kg. So 210 will be 1 ml of dopamine and a bit more lah if you want to be really strict, kan? Lepas tu kena buka satu lagi ampule kalau kita nak really strict. So 210 mg in 50 cc dan dalam 50 cc syringe. So jadi 1 ml is going to be 4.2 mg. Betul tak? Kalau boleh keluarkan calculator, the hands on is going to be your calculation at the phone. Boleh kira, tolong kira sekali. So, 210 bagi 50 jadi 4.2 mg. Jadi 4.2 mg ni, 1 mg equivalent to 1000 mic. 1 mg is equivalent to 1000 mic. Jadi, sama dengan 4200 mic per minute. So, kalau kita run 1 minute per hour, sama dengan 4200 mic per hour. Jadi kalau in 1 minute, kita dah 1 minute 4200 bagi 60. So 1 hour ada 60 minutes. So bagi 60, then it's going to be 70 miles per minute. So kemudian kita nak per kg. So for the patient body weight kan. So kita bagi lagi 70 miles per minute ni bagi 70. So it's going to be 1 mile per kg per minute. So actually based on this assumption, 3 mg per kg, then we can say that if we are running 1 mil per hour, then that is equivalent to 1 mile per kg per minute. So that 5 mils per hour, we just say is now 5 miles per kg per minute. Thus, sometimes 10 mils per hour, 10 miles per kg per minute. But most of the time, kita takkan nak buka dari satu ampule dopamine lah, ambil satu dia 200 cukup. So, most of the time, same formula as actually, sorry, that's actually same formula as dopamine. 1 ampule is 250 mg, the concentration is 12.5 mg per ml. So that's a big bottle. So dilution sama, 3 mg per kg. So kita assume sama macam dopamine tadi. So 1 ml per hour sama dengan 1 ml per kg per minute. Kalau kita dilute 80 bahagi lagi dengan 60. So jadi 1.33 ml per minute. Jadi that's assuming that dilution 4 mg in 50, maksudnya 1 ml per hour sama dengan kita kata je lah 1 mic per minute. Kita malas tak kira lah 1 mil per hour sama dengan 1.33 mic per minute. So kita just assume 1 mil per hour sama dengan 1 mic per minute. So tapi kalau kita kadang-kadang guna 2 ampule, so it's going to be 8 mg. So kita just double it lah. 1 mil per hour now, 8000 mic in 50 is 160 mic. So in 1 minute, 160 bagi 60, 2.67 mic per minute. That's for 8 mg in 50, 1 mil per hour sama dengan 2.67 mic. So for simplification purpose, 1 mil per hour sama dengan 2 mic per minute. Jadi bila kita buat dilution, kita kena tulis betul 4 mg in 50 running at what? So that people know. So kadang-kadang rarely we use adrenaline. So adrenaline 1 mg 1 mg. So concentration ni 1 mg per minute. Jadi dilution yang kita guna either 3 mg or 6 mg. So 3 mg means 3 ampules. 6 mg 6 ampules. So kita dilute in 50 cc. So if 3 mg in 50 cc, kita assume the same formula as noradrenaline. So kalau 3 mg in 50 cc, so 1 ml per hour equivalent dengan sama tadi macam norad. 1 ml per hour sama dengan 1 mic per minute. Kalau if 6 mg in 50, maksudnya double 1 ml per hour sama dengan 2 mic per minute. Excellent. Okay. I think now the shift is going to be sedation next. Any questions so far?
Okay. Sedation in ICU lah basically. Because usually kadang-kadang patient dapat OT, ada a lot of cases like patient kita cakap tadi, we will send to ICU. Yang ni transfer to ICU. Yeah, I just wondering, kat sini semua memang GA nurses ke ada? I can see a few yang scrub nurses and yang lain GA nurses. Okay, so basically I'm going to talk about yang biasa kita gunakan lah, sedation yang biasa kita gunakan. First is midazolam. I'll just run through midazolam, midamorphine, midafentanyl and Sedation lah, the one that we usually use in our hospital. Okay, so midazolam, so the dosage here yang so the dosage is 20 to 100 mic per kilo per hour. So basically dilution is you dilute as about okay, this is the example of the bottle. But in latte is a bit different. The ampoule is a bit different. But the most important you see is the dilution here. Okay, the dilution here. So okay, for dilution usually we put in 50 cc punya syringe lah. Okay, so the dilution should come up to 1 mg per ml. That's if you take the 5 mg punya 5 mg midazolam, so you take 10 ampules in 50 cc. So it comes up to 1 mg per ml, right? Understand? Boleh faham kan? Okay. So basically the indication is sedation for ventilated patients lah. Kita for OT for ICU ventilated, some sedation, ventilate overnight or something, you just start midazolam also. Okay, so usually we will start at 2 to 3 ml per hour, then you titrate accordingly lah. Okay, see how sedated you want the patient to be. Okay. Right, another picture. So there's a lot of ampules. The one usually in our hospital is 1 mg per ml and 5 mg per ml. Okay, so this one is I got it from the net, is 5 mg per ml and 50 mg per ml. So basically, if you want to dilute, you have to add up with water or normal saline. Okay, make it 1 mg per ml. Okay, midamorphine. Midamorphine is basically just the dilute midazolam plus morphine to make midamorphine infusion. Okay, so basically the dilution should come to 1 mg per 1 mg plus 1 mg morphine per ml. So this you can get by 10 ampules of mida. This one I'm using the 5 mg per ml, 5 mg midazolam. Okay, so 5 mg midazolam times 10, that's 50, correct? Okay, plus 5 ampules of morphine. Morphine, the one we usually use is 10 mg per ml, correct? Okay, 10 mg per ml. So that's 5 ampules of morphine and 10 ampules of midazolam. So the dilution will come up to 1 mg mida and 1 mg morphine per ml. Okay, alright. So midamorphine you have to avoid in renal impact patient. Okay, this is according to the ICU protocol. Okay, so at 3 to 5 ml per hour, and this will also be titrated accordingly. Depends on how deeply you want to sedate the patient. So if say for normal patient that you can keep, show if you know RAS. The RAS score. Okay, so this is the example of morphine. In our hospital it's different, it's a different activity. But basically the dilution is the same, 10 milligram per minute. Vidofentanil, dilution of 1 milligram vida plus 10 mic. Okay, the usual ampule of fentanyl is how many mic per ampule? Okay, 1 ampule is usually how many mils? 2 mils, correct. Per mil, that's how many mic? 50 mic. Okay, so 1 ampule consists of 100 mic fentanyl. Okay, 2 mils. Okay. So for the dilution for vidofentanil, you dilute 10 ampules of midazolam. This is also the 5 milligram midazolam per ampule, 5 milligram plus 5 ampules of fentanyl. Okay. So this one will be this 5 milligram and 5 milligram per mil is the ampule is usually in 5 mil ampules. Okay. So when you stretch out 10, it will come up to 50 mils. This one, 2 mils times 5, it's 10. So you add up, it will become up to around 60 cc. But you can to keep it in the 50 range. Okay, so, but the dilution should be 1 milligram midazolam and 10 mic fentanyl per mil. Okay, so this also described the 3 to 5 mils per hour. Okay, then factor accordingly. Okay, the last one is this is example of fentanyl. Okay, this is not the ampule in our hospital, but the dilution is the same. Okay, see the dilution 10 mic per 2 mil, so it's 50 mic per mil. Okay, precedents. Another that we usually use in ICU. Usually precedent is we use if see the indication here. We aim for early extubation of the patient. Okay, say just to ventilate overnight. You want to extubate early the next morning, then we can use precedents like intestinal propagation. But it's also used as adjunct for sedation and GA. But you have to be careful because precedents can cause hypotension and breathing. Okay, so basically the dilution is 4 mic per mil. I'll show you the picture first. This is what we have in our hospital. Okay, it's the 2 mil ampule with 100 mic per mil. So it comes up to 200 mic per ampule. Okay, dosage is 0.2 to 0.7 mic per kilo per hour. Okay, so the dilution is 4 mic. It comes up to 4 mic per mil. Means you take 1 ampule, dilute in 50 cc normal saline. Okay, so 200 you divide by 50 comes up to 4 mic. Okay. So how do we know how much we want to give? It's quite it's big for us to calculate this, correct? 0.2 to 0.7 per mic per kilo per hour. So usually the drug will come with a sedation chart. So you refer to the chart of how much you want to give the patient. Okay. So this one, you see the patient weight. See, is it 70 kilos? They start off with 3.5 kilos per hour. Okay. Yeah. So this is the how much mils you want to give the patient. But you have to remember, put in mind that when you titrate the precedent, you always have to see how hemodynamically how the patient is. Okay, because we know earlier that it can cause hypertension and breathing. Okay. Alright, I think is there any questions?
Dah boleh terima.
Okay.
So I'll proceed with miscellaneous drugs. Okay, as we go on from inotropes, then we go to the sedation part, and now I go on with the miscellaneous drug. Basically, it's a kind of supporting drugs. Okay, first I'll go through with amiodarone, then I'll go through with sodium bicarbonate, magnesium sulfate, calcium gluconate, and also aminophylline. Right? I think all of you is aware of all the drugs. Okay. So amiodarone usually we use for anti-arrhythmic agent. Okay, usually in life-threatening ventricular arrhythmias. Okay, when basically we use in SVT. We saw in the 12-day ECG, SVT, then the doctors usually ordered for amiodarone. Okay, alright. So the dilutional and also the dosage for it is. Sorry. Okay, so here will be loading dose 300 mg in 100 ml. The dextrose 5 run over 1 hour equals to 100 ml over over hour. Okay, anyone knows 1 ampule of amiodarone consists of how many milligrams? Sorry? Alright, good. 158? 5 ml. Do you have this reader? Oh, I see. Okay. Alright, so diluted in 100 ml, dextrose 5%, and run it over 1 hour. As for the maintenance, it's 600 mg in 500 ml, dextrose 5%, run over 23 hours, that equals to 21 ml per hour. Okay, but you need to be cautious, alright? You need to monitor the patient very carefully because of the heart rate of the patient. If the patient heart rate is between 80 to 100 beats per minute, so you have to reduce it slowly to 10 beats per hour. But if the heart is less than that, you need to off it. Okay? Alright. So next we go to sodium bicarbonate. It's an alkalinizing agent. Okay, indication is for cardiac arrest, hypokalemia, and for severe metabolic acidosis. Right? Okay, the dilutional and also dosage. First, in cardiac arrest, we use initially of 1 milliequilibrium over kilogram and over dose. So, anyone here knows that 1 ampule of sodium bicarbonate consists how many milliequilibrium? Kalau tak ada orang jawab, saya tanya orang yang saya kenal. Ada tak? Anyone? Okay, barisan 1, 2, 3, 4. Barisan 4. Dari barisan 4 ada tak? Ada volunteer? Kartu? Berapa? How many? Okay, yeah, the 10 milliequilibrium, right? In 10 ml. Okay, equals to 10 millimole. Alright, so yeah, so for the cardiac arrest, initially you have to give according to the patient body weight. You agak-agak je lah kan, takkan you nak timbang patient tu. Kita nak cardiac arrest, semua timbang lah. You agak-agak lah. Okay, normal build, you agak 50, then you bagi 50 lah. Right? Okay. For hypokalemia, okay, it's 50 milliequilibrium intravenously over 5 minutes. Okay. This one, everything, you need to monitor the ECG also, right? Okay. Then for severe metabolic acidosis, you need to give 2 to 5 milliequilibrium over also body weight of patient, infusion over 4 to 8 hours. Okay. Then there's an extra there, prevention for contrast-induced nephropathy. Kenapa buat tak? Jangan makan kalau ICU tu kenapa? Tak penting, this is your additional, right? 75 ml in 500 ml of dextrose 5. Okay, the dose is here, 3 ml per kilogram bolus, and maximum you need to careful is 300 ml. Over 1 hour prior to procedure, and 1 ml per kilo per hour, maximum is 100 ml also, during and for 6 hours of post-procedure. Next one is for rhabdomyolysis. Who knows what is the rhabdomyolysis? Yang penting kasih investigation apa tahu? Tahu tak? Usually doktor cakap CK. Right? It's muscles. Okay? Process of the muscle. So 10 to 20 ml per hour. Pure titrated to achieve the urine. You see, look at the urine pH more than 6.5. Or the blood pH is more than 7.5 and also serum bicarbonate is more than 1 mol per hour. Okay, next we go to magnesium sulfate. So far so good? Kenapa rumah pun ada. Okay, so magnesium sulfate is an electrolyte. It's also smooth muscle relaxant and also anti-arrhythmic. So this is the indication. Okay, biasalah kalau magnesium, kalau low, hypomagnesemia, dia bagi magnesium kita bapak kan. Okay, kalau tengok RT balik, tengok doktor magnesium low, dia cakap, okay, dia bapak. Okay, seizure prophylaxis for pre-eclampsia and eclampsia. Okay, do you know what is pre-eclampsia, eclampsia? Usually pregnant lady lah, right? Okay, BP memang shoot up boleh. Okay, arrhythmia, torsades, equantus. Outside already now, for okay, and also in asthma, right? Now correspond to conventional therapy. Okay. So this is dilutional drugs, right? Usually it's the same as 1 and 2, 3 meals, you run over 1 hour, right? The rest is all the same, sama saja. Okay. Cuma asthma, you need to bolus 5 to 10 more given over 20 minutes or continuous infusion, 1 to 2 grams. Boleh faham? Okay. Alright. Okay, so calcium gluconate, dosage dia 500 mg over kilo, 1 and 2, but over 50 ml per hour. Okay. Alright, that's all.